Tyler, the unique thing about National Healthcare Decisions Day, it aims to raise awareness about the importance of advanced care planning and encourage people to express their wishes regarding healthcare decisions. Now, as smart as that sounds, I was today years old when I found out about National Healthcare Decisions Day. So it's only right that we have a professional come on here to talk a little bit more about healthcare decisions, things of that nature. From Henry Ford Health, West Bloomfield, joining the Splash Live, Dr. Emily Hurst, who specializes in critical care medicine as well as palliative and hospice medicine. Did I say that correct, doctor?
Yes, sir. Good morning. Thank you.
Thank you so much for your time. Thank you for joining us, Dr. Hurst. See, I always like to make sure I'm pronouncing things here
All
right
good.
in the splash. So, National Healthcare Decisions Day, such a unique, random day. I want to talk about that. But first, can we get into your specialty first? Critical care medicine, as well as palliative and hospice medicine. Can you
Mhm.
talk about these specialties? Are they specialties and how are they different from a regular primary care physician?
Yeah, so I actually started out in primary care and eventually ended up going into hospice and palliative care, which is dealing with people in critical issues at the end of their life. Hospice is at the
Mm,
last 6 months of their life. Palliative care can be any time when they have a critical illness and they need to have some additional support so that they're not suffering and having pain. And then
great.
critical care is when they're in the ICU and they're at their sickest of their sick. Actually, a lot of people didn't think when I started both that they were intertwined, but unfortunately, about 25% of people that go to an ICU are so sick that they don't survive. And so, talking about the palliation of their suffering and end of life goals are very important in both settings.
Yes. So, just like I initially thought, very specialized care for people in certain situations. So, definitely not your regular primary care physician. Complete difference there. Thank you for stating that. So, we're here talking about Healthcare Decisions Day. Very, very specific niche topic we're talking about, but it's raising the awareness of the importance of advanced care planning. What is advanced care planning exactly?
Advanced care planning is laying out decisions that you would like to make on your behalf in the event that you have a critical illness, or in the event that you're not able to speak on your own behalf, like decisions on
Mm.
what type of feeding you'd want, whether you'd want to be on a ventilator, whether you'd want CPR. All of those things are really important things for not only your healthcare providers, but your family to know on your behalf if ever you're in the situation where you have an unexpected or even an expected critical illness or end of life decision situation.
Whoa. Okay. That's enlightening. That's enlightening, Dr. Hurst. Okay, so now my brain is going there now. So this is one of those situations where we don't like to think about it or talk about it,
Right.
but it's something that needs to come up. It's something that needs to be planned, like we just said. So is this something that's usually expressed in a document, in a will of some sorts? How is this actually expressed to our doctors or our specialists?
Yeah, that's a great question. There are lots of different ways that you can express your wishes. You can put your information in your will and testimony, but having advanced care documentation is the best way for you to relate to not only your family but your healthcare workers what you
Mm.
want them to do on their behalf. There is also a program that the state instituted in 2018 called MI Post, which is MI Michigan Physician Orders for Scope of Treatment. And that is a document that is not just implemented like when you're in the hospital or when you're in a long term care facility. That goes with you no matter where you are. If you were in a car accident on the side of the road, if you're in a grocery store, if you're in a long term care facility or in a hospital, and somebody didn't know that you had ended up there, they know what you want because that form goes with you wherever you are in the state.
Oh yes. Oh, I can get into a personal situation with this. I want to speak on, so that's why I'm like my brain is going crazy. But thank you for explaining it. Join us right now, Dr. Emily Hurst from Henry Ford Health in West Bloomfield, specializing in critical care medicine as well as palliative and hospice medicine, talking about National Healthcare Decisions Day. Things going on. So we're promoting the awareness of advanced care planning. What challenges have you faced in promoting this advanced care planning, which is very, very important?
Yeah, unfortunately, a lot of people think that anything around critical illness or end of life issues is kind of a taboo topic. They think if they talk
Mm-hmm.
about it, it's going to happen. But
Mm-hmm.
we also struggle with even just talking with our primary care physicians and presenting it to their patients when they have their regular yearly visits, because there's stigma around it and how they feel it'll impact their patient relationships. And then sometimes people are just busy and they don't want to talk about things that aren't directly impacting them at the moment. So they don't think about this as something that they want to have known to their family or healthcare providers.
Yes. Yeah. So my personal situation is essentially my aunt out of nowhere ended up on her deathbed, unfortunately. This was in 2020. And, it was a situation where she was on life support, and we were fortunate enough to have the family drive to Tennessee where she was at the time to give our last words. I had my opportunity, but, that's a perfect situation where who knows what she would have actually wanted to do. She wasn't in a position to speak at the time. So we had to make a decision for her as a family, but who knows what her wishes would have actually been had she had that advanced care planning and known a little bit more about that. So I'm so glad that we're talking a little bit more about this. And yes, it is a taboo topic, but at the same time, we have to encourage people. So how can we encourage more people to engage in advanced care planning, Dr. Hurst?
Yeah, having open discussions with your loved ones. It's often really interesting, and you might be really surprised about their answers. And the other part that's really hard
Hmm.
on this end
Hmm.
is I see families all the time struggling with exactly the situation you just gave with your aunt. They don't know what their loved ones want. They've literally never talked about it. And
Right.
sometimes that's even with people who are in their 90s. And so they struggle with trying to make the decision on behalf of their loved one. And so supporting MI Post, there's another wonderful program called Death and Dollars Over Dinner, where you sit down with your family and you make a big, nice dinner, and you just, every person at the table, even the little ones, to participate, talk about what they would want if they were in a circumstance where they
Mm.
couldn't make their wishes known. And you learn a whole lot about your family. And we've done several programs here at Henry Ford, and we're going to continue that program. My family just asked when we're going to do it again because they really enjoyed the conversation.
Yeah, yeah. I enjoy having those what people would consider uncomfortable conversations. They're usually truth conversations that people don't want to have. So let's
Yep.
have them death and dollars at the dinner table. Dollars, finances is a whole nother topic, but that's
Yep.
another thing people usually don't want to talk about at the dinner table. So where do you see healthcare decisions heading in the future?
So I really hope that we do more with MI Post. It was in 2018 that it was instituted, but it's still not widely known and utilized. So
Hmm.
getting more people to use it in our state. And then I really hope it goes to the national post program so that no matter where you are, even if you're outside of the state of Michigan, somebody is able to know what your wishes are on your behalf if you're unable to communicate what those might be. Um, so those are my wishes for the future in the program.
Absolutely, absolutely. And we appreciate your time and your information, Dr. Hurst. Any last words, any advice you would give to those unsure about discussing healthcare wishes or just any vital information for the community in general?
Yeah, I think it's just holding these types of discussions don't hurt you, and they really may help others better know what you are wanting in those times so that they're not burdened with trying to guess with what you want.
Right.
It's a really big deal and it's helpful to your loved ones and anybody else who might be providing care for you. So I definitely encourage it. And I'm really glad there's a day that's celebrating these discussions.
Per usual, as I get to talk and get to know my guests, I always just want to. I have so many more questions, but we appreciate your time. We know you have so much more to do, but we appreciate it. Like I said, specializing in critical care medicine as well as palliative and hospice medicine at Henry Ford Health, West Bloomfield, Dr. Emily Hurst. Thank you again.
Thank you, sir.